everyone see the correct content?
Yes.
Yes, yes.
Okay, so I'm sorry that, okay, so let me get back again. And so the problem is we also have to know that when to shift to systemic therapy when it is inevitable. So that's Steve will mention that when he has to think about the systemic therapy. So according to the publication, the same one, the dermatologist should be familiar with systemic therapy in treating inflammatory dermatosis. So when non-adherence cannot be overcome, this is also the issue that Steve will focus on. So how I manage a patient under inadequate disease control. So for extensive but mild lesions, I usually have.
Yeah, excellent. Good. Okay, so for the next 10 minutes or less, I'm going to talk about optimizing topical steroid use. If I mention products, you can assume that I have some conflict of interest. We'll talk very briefly about the foundation of using topical steroids. Then I want to focus on the evidence that patients aren't using them very well, and then how to optimize the treatment. In other words, how do we optimize adherence? So when I think of topical steroid use, I think of, using the right potency, the right vehicle, the right amount, and then getting patients to use the treatment well. I know there's 7 potency classes. I only think of 3 in my practice. I need a low, a medium, and a high. And then I need to give people the right vehicle. And I was taught, okay, you want to use an ointment to moisturize or a cream to dry things out, but you have to account for whether patients will use one over the other. And then the quantity, I think dermatologists are familiar with. Okay.
No, I am.
Oh,
yeah.
okay.
So now we already heard the trick of using topical steroid in clinical dermatology, though. But now, I'm using corticosteroid, and I think Patrick has already mentioned some of my studies. And this is my disclosures. The lasers that I will be mentioned today, sometimes I got the research grant and sometimes equipment loan from the company. What I'm using, since I'm the princess of lasers, so I'm using lasers with topical corticosteroid, and the modality I'm using is called laser-assisted topical corticosteroid delivery. For those of you who are not familiar with the technique, I will go over this very, very quick. But since all we are dermatologists, we know that when you apply anything on your skin, stratum corneum is the rate limiting step for the absorption. And the thicker the stratum corneum is, the less the amount of absorption it is. So
my topic is, title is also focus on the aesthetic practice. So maybe the topical steroid can act as a conductor of a gentle healing process. It's my disclosure. So while we're doing the aesthetic procedures, we can see some obstacles can inhibit normal healing process. Like we can see eczematous response and laser-induced burn in IPL or long pulse laser, and acne and some infections, and dry skin and sensitive skins. Those ones can be eliminated by corticosteroid. So corticosteroid is one of the main, very important armamentarium for us. It's my opinion of corticosteroid use for aesthetic procedures.